mynews.studio.
A million lives saved, 170 million malaria cases prevented in just 1 year. How did this global turnaround happen so fast?
Today is December 12th, 2025. The World Health Organization's latest World Malaria Report just came out, and honestly, the numbers caught a lot of people off guard. 1 million deaths averted, 170 million cases prevented in 2024 alone. That isn't just a small improvement, that's a huge jump. So what actually changed?
It came down to a mix of new tools, next-generation insecticide-treated bed nets, and the rollout of malaria vaccines. But they weren't handed out randomly. The real focus was on kids and people at highest risk in places where malaria is most common. That's where the majority of deaths actually happen. But why did these particular interventions have such a big impact?
So was it really about the technology itself, or more about how quickly these things reached the people who needed them? Because let's be honest, distribution and funding in the poorest regions have always slowed things down. How did they get around that this time?
The process got streamlined by local governments and agencies. They didn't do it alone. They worked with international donors to match support to what each country actually needed. For instance, in Cambodia, real-time data guided resources straight to remote spots. In Africa, there's something called the high-burden, high-impact approach.
Wait, what's the high-burden, high-impact approach? Can you explain that a bit?
Sure, it's when health ministers coordinate closely, strengthening national systems to really focus on the worst-hit areas. The strategy isn't just about one solution. It's about layering seasonal malaria chemoprevention, new bed nets, vaccines, and especially targeting the most vulnerable: children under 5, pregnant women, migrants, even people in conflict zones.
Let's look at some numbers. Seasonal malaria chemoprevention reached 53 million children in 2023. Next-gen nets were rolled out in places like Nigeria. Vaccines? They're now part of routine immunization in 17 countries. Do we know how many children actually got the vaccine?
By the end of 2024, 2 million children had been vaccinated in Ghana, Kenya, and Malawi. These are WHO-recommended vaccines, RTS-SS01 and R21/Matrix-M. Early results show that tens of thousands of lives are being saved each year. That's impressive for a single intervention, but it's the combination of these tools that's really moving the needle.
What about the ongoing challenges? Insecticide resistance and climate change have always been big issues. Are these new tools enough to deal with those?
Not entirely. Insecticide resistance is still evolving, especially as new mosquito species like Anopheles stephensi are appearing in cities. That's why the next-gen nets are made to tackle multiple kinds of resistance. Vaccines do help, but how far they reach depends on funding and tracking cases. And with climate change extending the malaria season in some places, using a mix of approaches is even more important.
So, does this mean eradication is now within reach, or are we just getting better at managing a tough disease?
It's a bit of both. The number of malaria-free countries keeps going up. This year, Georgia, Suriname, and Timor-Leste were certified malaria-free. That brings the total to 47 countries and 1 territory. But the real headline is the steep drop in cases and deaths where malaria still circulates. That shows what's possible when investment, global cooperation, and innovation come together.
And why does this matter beyond malaria itself? Because it's proof that big public health threats can be tackled if science, good data, and international teamwork are all in place. It's almost a blueprint for fighting other diseases, isn't it?
Exactly. The approach is clear: invest in tools, shore up health systems, and use data to guide efforts. The results are measurable, and that's rare. It gives hope for other global health problems.
So, while the headlines are striking, the real story is about getting systems and cooperation to work. Is it something that can last?
That's the big question: keeping up the funding and staying flexible as new challenges come up. But what we've seen this year is that major change really is possible.
1 million lives saved in 1 year. It's real evidence that breakthroughs in global health are more than just theories.
Thanks for joining us as we unpacked the numbers and looked at what's really behind the headlines.
This was a look at how science and cooperation can change the course of a disease.
Thank you for listening. This episode was powered by mynews.studio. Try now for free.